Within the past few years, a lot of new research has been coming out showing a link between being overweight or obese and having certain skin conditions. Here at Fighting Eczema, we focus on finding the root causes of people's skin conditions, such as eczema, psoriasis, maybe topical steroid withdrawal, and this new research is really good for us to hear because now that we know that being overweight can be contributing to your skin issues, that's something we can work on. In this video, I'm going to briefly summarize some of the best research we have on this topic that you should know about if you're suffering from an inflammatory skin condition, and then we'll quickly talk about how you can determine if you are overweight or obese and if going on a weight loss journey might be something worth considering for you. All right, so let's get into the video. Hello everybody, my name is Larry. Welcome to Fighting Eczema. The first study I want to share with you is a study that was done in 2015. So this study is what is called a systematic review and meta-analysis, meaning that it's one study that takes a bunch of other studies and kind of compares and summarizes them to try and answer a very specific research question. So this study essentially summarized 30 other studies that all aimed to determine if being overweight or obese had any association with atopic dermatitis. What the analysis found was that yes, adult and children who were overweight or obese seemed to be more likely to have atopic dermatitis. However, the study found that this association was only true in North America and Asia, but not Europe. Now, this is very interesting information, right? Why would adult and children who are overweight and obese in two continents, North America and Asia, be more likely to have atopic dermatitis, but in another continent, Europe, this wasn't the case? Why? So I decided to really look into this analysis, and what I found was that out of the 30 studies that the analysis included, 11 of them were done specifically in Europe. The interesting thing is that out of those 11 studies that were done specifically in Europe, some of them did show associations between being overweight and obese and having atopic dermatitis. However, some of them did not show that. And so ultimately the analysis decided that there's not enough information in these studies to really say, yes, there's a link between obesity or being overweight and having atopic dermatitis in Europe. All right, but the studies in North America and Asia did show much more significant results. And so ultimately, the researchers who conducted this analysis suggest that more research needs to be done in Europe before they can make any conclusions. Now, I just want to mention that all of the studies and information that I talk about in this video is going to be linked in the description down below if you want to check out the information yourself. Funny enough, the next study I want to discuss with you is a population study that was done in Europe, more specifically in the UK. So this study took a look at 400,000 people in the UK who had eczema and 1.8 million people who did not have eczema. Researchers then asked themselves, is this group of 400,000 people with eczema more likely to be obese than this 1.8 million group of people without eczema? The answer that they found was yes. The group who had eczema had an 8% higher chance of being obese in comparison to the group without eczema. Now, you might be thinking this 8% association is not a lot, right? And I guess you're right. However, if you're in a position where you have severe eczema or some other skin condition and you're seeing this information and you're like, the association is just so small, so I'm not going to lose weight. If that's your mindset, I don't know what to tell you. It just doesn't seem like you're that serious about healing your skin. Those of you who are in one of our Fighting Eczema programs, you know that if you're overweight or obese and you're not willing to work on that, we won't work with you. Right? So shout out to those of you who are in one of our Fighting Eczema programs and is working hard to reach your ideal weight. Keep up the good work. Now, one more interesting finding from this study that I want to mention is that the severity of eczema was not associated with the level of obesity. So just because you're more obese doesn't necessarily mean that your eczema will be more severe. All right, so now that we have some proof to show that obesity can be contributing to your skin issues, let's talk about the mechanism or the why behind it. Researchers suggest that when people are overweight, they have more adipose tissue or basically fat tissue. This increased adipose tissue means increased production of certain molecules in the body, especially inflammatory molecules, and that's what leads to a chronic state of inflammation in the body. Obviously, if you have an inflammatory skin condition such as eczema or topical steroid withdrawal, You do not want your body to be in any state of inflammation at all. Another finding that researchers are looking into is in regards to hunger hormones. Researchers have seen that people who have atopic dermatitis seem to have abnormal levels of certain hunger hormones, including adiponectin, resistin, and leptin, in comparison to people who don't have atopic dermatitis. This research is very new, so not a lot of information is really known about it yet, but researchers suggest that this hormone imbalance leads to immune system dysregulation. And as you might know, inflammatory skin conditions, yes, you can call them skin conditions, but you can also classify them as immune system conditions. Hopefully, researchers will continue to do research on this topic and we'll learn more about it in the future. Okay, so now let me ask the question a lot of you might be wondering. If I have dermatitis and I'm overweight, if I lose weight, will that reduce my dermatitis? Well, for those of you who have this question, lucky for you, a study was actually done in 2020 to see if this was the case. Researchers took 40 people who had dermatitis and split them into two groups. One group was told to lose weight, and they were also given a lot of support and advice on how to lose weight. The other group was just told to maintain their weight. Another piece of important information is that everyone in this study was not allowed to increase their use of any medications. And so we know for a fact that any positive results were not due to medication usage. So 3 months later, results from this study concluded that people in the weight loss group improved their skin significantly more than the people who were told to maintain their weight. Yay! So hopefully by now you're starting to see this connection between being overweight and having skin issues. Now, one thing from the study I want to mention is that a lot of people in the weight loss group ended up dropping out of the study. So they started with 20 people, but they only ended up with 8 people finishing the 3-month weight loss journey. This is not really surprising because weight loss is freaking hard, right? So if you are considering embarking on your own weight loss journey, I really recommend that you seek out as much support as you can. If you want to work with me personally, you can check out our programs at fightingeczema.com. I'd be happy to support you through your own weight loss journey. Before we talk about how to determine if you are overweight or obese, I'm going to ask you to hit the like button if you're finding this video useful, as it'll help the video spread to other people who are suffering from inflammatory skin conditions. Thank you very much. To determine if you're overweight or obese, you're going to want to calculate what's called your body mass index, or BMI. To do this, all you have to do is type in BMI calculator into Google and use one of the many calculators that comes up. Here's an example of my BMI. Once you get your own BMI calculated, you can compare it to the chart that's provided, and it'll help you determine if you're maybe overweight or obese. Now, BMI is just a starting point. It can actually be a little bit inaccurate for certain populations, such as athletes or the elderly. So again, I really recommend that you work with your favorite healthcare provider to determine your ideal body weight. But in general, your BMI will give you an idea of where you stand. For example, if you're starting to see your BMI be 27, 28, 29, or higher than that, you may want to consider adding weight loss into your skin healing journey. Like I mentioned before, weight loss is hard, and battling skin conditions is even harder. If you want to learn more about healing your skin holistically, check out the video that's just popped up on your screen. Thank you so much for watching, and I'll see you in the next one. Bye for now.